guys, just it will be more of an interactive session. So I expect answers from you because these are very normal things, you know. So, and I'm sorry, I may be able to just attack any person to give us a response. So yes, first aid, first aid. What is first aid? Let me start from there. I have 3 questions, then we'll just start. What is first aid? Okay. Yeah, so Beauty can tell us. No, it's okay. Yeah, John, what is first aid? Okay, well, I'm not very sure whether you guys can hear me, but anybody having any response on what first aid is? Well, I think I know most of us.
You may be the first one on
because we are here to learn. Okay, I didn't.
So I was just going to say you may be the first one on the scene to be able to offer assistance.
Oh, thank you so much. That is basically what first aid. First aid is like the first or the immediate care that you give to a victim with an injury or maybe an illness. And in my slides, there are 3 definitions of first aid. You can choose which one you want to use. Or treatment that you give to someone who is injured, or the different types of accidents. So before you do, like, even as you do first aid, and after doing first aid, you are seeking a medical attention or a service, for example. So before this service is reached for, or before this service actually is sought for, then the first thing you're doing basically is first aid. According to the second definition, it's normally performed until the injury or illness is satisfactorily dealt with. But you understand that this is not like most of the cases. This is not the case. Okay, well, I don't know why Chrome is just popping up with a lot of shit. Okay, let me put it. Is my presentation a presentation mode? Are my slides in a presentation mode, Denzel? They're not. But are they moving? Oh, they're not. Okay, well, I don't know why when I put them in presentation mode, they don't move. So basically, that is what the definition of first aid is. And we have, what are the main aims? But then we have a lot of aim, what we are aiming at in doing first aid. But the 3 major aims of doing a first aid is to preserve life, to prevent further injury, and to promote recovery. That is the 3 major aims of doing first aid. That you want to preserve life. You don't want this person to die. You want to prevent further injuries, and you want to promote recovery in this case. And so by doing every steps you want to do, we are basically aiming at these three major events, three major aims. So, as a first aider, I think that one I'll come to that later. Let's go to the golden rule of first aid. There are rules that, as a first aider, you have to put in place. Number one, do first things first. Like, once you get into a scene, first things first. And this means that if anything there's a panic sites, then make sure everything is relaxed. Like, make people relax. Unless otherwise, it's an emergency of which things should be done without being panicking. Example of what we talked about the other time. That imagine someone has been bitten by a snake, then these people are panicking, and you as a first aider, you get into the site and you also start panicking. You mess everything up. So don't panic. Make sure first things are done first. Then they are done quickly, quietly, and without panic. The three things. Make sure every thing you're doing is done quickly, quietly, and without panic. That is the first golden rule. Then secondly, we have what we call artificial respiration, and we'll be able to talk about ABCs in a few. Artificial respiration is more of like providing breathing. Okay. Yes, Denzel. Yeah. Actually, I've tried on slideshow. Even right now, it's on slideshow mode. But can you see? Okay, well, so I think it can't go on slideshow. Let me just zoom in so that is it better now? Mm, it should be better now. Okay. Well, so you'll just pardon me. I don't know why if at any given time I put it on a slideshow, it doesn't really go. Like right now, it's on a slideshow, but I don't know why you guys cannot see. But we got okay. Well, I'm in slideshow, setup slideshow. Yeah, I'm there. Okay, I've pressed. Imekuja. Oh, is it moving? Oh, thank you so much. Yeah, thank you for the assistance. I think the direct slideshow wasn't picking up. Now, I've talked of two golden rule in first aid. The first one is that you do fast things quickly, quietly, and without panic. Number two, I've talked about giving artificial respiration, and we'll be able to see various ways to do this in a few. Number three, you are aiming to stop bleeding. So, even as you do all this, you're making sure these people are not bleeding. Then you're also guarding against, or you're treating for shock in specific cases. Then do not attempt to do too much than you can actually afford. That is why we are saying first things first. Let me give an example. You reach an accident, like a site where an accident has occurred, and there are three categories of yes, there are three categories of victims. There are people who are making noise. There are people who are just like they're just calm. It's like even they're dead, but they're not. Then there's this last group who are just conscious, but wametulia tu, and they can see, they can hear, they can do all that. So which group should you start from? Yeah. So first things first. We'll be able to talk about that in a few. Then reassure the casualty and those around, and like reassure them and those who are around uh, that they actually need to lessen their anxiety. And reassuring them doesn't mean telling them that everything will be okay when you are seeing that things will not be okay. So uh, just give them some hope, and continue with what you're doing. And do not allow people to crowd around, where you're doing the exercise. Yeah, so basically this one is a matter of like this one will give them fresh air. At the same time, this one will also make you, like the patient or the victim, feel comfortable. And we also have privacy issues and even confidentiality as well. uh, do not remove clothes unnecessarily in such cases. So these are just the golden rule of first aid that every first aider must actually know. So next is about the philosophy of any first aid you're doing. So in a pre-hospital setting, the key contributor to survival and recovery from illness and injury are function. Like when we talk of airways, breathing, circulation, and bleeding control, but in bleeding control, it's quite under body's primary functions. You guys know that you can't survive without oxygen. That targets both the breathing and the circulatory, and even the airways. You guys know you can't survive without the blood supply of oxygen to all the parts of the body, mostly to the brain. So the main philosophy of doing every first aid is to make sure that the body's primary function are actually in the right state. So airways, breathing, circulation, and this the last one. It's called D. D should be danger, and D, in an hospital setting, will also represent dextrose, and this generally means that you are basically providing energy to this person. So uh, it is ABCD. A is airways. We are dealing with breathing and circulation. In a few, we'll be able to understand why these are very important. And bleeding can be very life-threatening, by the way, because if you breathe profusely and you are losing a lot of uh, blood, you can easily die. You all know about it. But though bleeding is part of circulation, so in number 4, just replace it with D, which represents danger. So as a first aider, make sure like wherever you are doing your first aid, you are not endangered. You are safe. That is the whole thing. So uh, I've talked about philosophy of first aid. I've talked about the basic aim of why we do first aid. And so I also want to just point of something about fundamentals. So of course, this is part of what we talked about. That you are targeting that all the A, B, C's and D are in order. The circulation of these people, the airways, the circulation, and the breathing are in order. And you are also also safe. You are also striving to control bleeding, and if there's any shock, you're assessing. As in, once you get into a site, these are the fundamental things you have to make sure are in place, and they just follow the way I've listed them. Number one, the first thing is make sure these people are having their ABCs right. Control bleeding. If they are in shock, then but the shock is a medical emergency. So if they're in shock, we'll talk about some few things you will do even as you ring the emergency number. One of the emergency number we know is 911. You can also ring 999 and all that. Even as you continue with this, make sure that the open wounds and burns are, are, are also dealt with. But these ones are now subsequent. Like these ones can be dealt with later, and transportation of even this person to the nearest facility. So on first aid kit, I'm very sure you guys know what is contained in first aid kit. I'm very sure. So I've listed them there: the gloves, the face shield, the safety pins, the plasters, the cotton wool, the iPads. We have the band dressing, the finger dressings, and all that. Yeah. I won't talk about that for now. I've listed them there. I'll send you the notes, and you'll be able to go through them. So this chain actually runs from okay, you as a medical missionary, or you as a first aider in this case, and it stretches across to 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 the hospital. So in the early stages, there are things you are required to do. For example, when you just get into a scene, you will probably see what is happening. If you can see, you can take history to confirm what has happened. You can also look for the symptoms, like the available symptoms, and you can always be able to tell. So the symptoms are basically what only the casualty can tell you about how they are feeling. How are you feeling now? I'm feeling maybe cold. I'm feeling let me say I'm having nausea and all that. But the signs are what you can see for yourself. You can see these people bleed. You can feel these people are having high fever and all that. So uh, I want us to check specific examples. I was giving you, by the way, a basic introduction for all first aiders. That any before you start doing anything, there are things that you have to consider. Number one, the ABCs. Number two, the bleeding, control of bleeding. Number three, it's about the confidentiality and all that. So let me give let me now point to specific examples as we continue. We've been talking about respiratory system. So I want to talk about a condition. Of course, this one we had talked about it. Nose bleeding, also called epistaxis. So I said when someone is nose bleeding, this is the position that you basically put them, so that they have their head tilt down to prevent the natural flow back of blood. This one is a type of injury, and we elaborately talked about it when we were handling the cardiovascular system. So I won't spend much time here, but the basic principle in this first aid is that number one, you are squeezing firmly the the point above the nose, so that you exert pressure to the blood vessels, so that you also facilitate the clotting process and you stop the bleeding. And the head is tilted to prevent the flow back. You can also apply a cold cold cloth on the face, just above the face, the forehead, just the forehead there, so that you also manage the vasoconstriction, vasodilation aspects. Yeah. This is where even as you plan to do first aid for, let me say, someone is having shock. I think shock is a respiratory. We'll talk about it in respiratory system disorders. So this is called a recovery position. It's one of the position which are recommended for any victim who like for different kind of conditions and situation when you are doing first aid. So number one, make sure that the person is lying on the right, on the left. A lot of pop-ups. Right? Yeah, this person is lying on the left, but if the injury is on the left, then they can do on the right. And basically, the right hand is supporting the head, and the knee is slightly, raised, like bent. I mean, so that it stops the body from, rolling onto the stomach. And make sure, if these people, depending on the condition, make sure their airways are open. Make sure they are breathing. If they are not breathing, we'll talk about a condition here. So this is called the recovery position. Very important for every medical missionary to know about the recovery position. And this one also promote the ABC's process of it. Yeah. So I've talked about ABCs. Now to specific examples. Number one is about the airways. Airways, just make sure these people, when you receive them, they don't they are not dressed heavily, and you don't just remove clothes for the sake. But make sure their airways are literally open. If they are having problems with maybe they are heavily dressed, just remove part of the clothes. If you look at this slide here, I think you can see my cursor. Sometimes people can experience a condition where their windpipe is basically blocked, and so they are not even breathing well or something. So this is one of the ways to promote the breathing itself. I mean, the breathing. So while I think you'll be able to appreciate this one. Let me roll back it over. I'll be back. Yeah, you can look at this condition. In the closed position, you see like this obstruction in the airways, and so it should be in a right angle to the body, so that the windpipe itself opens and you promote the breathing. So the open state is the very first picture you can see. So let's go back. So that is B, that is breathing. Make sure these people are breathing. If they can talk, ask them if they can breathe. You can also assess. Some people can have, how is it called? Sound breath, and this is not always recommended. Okay, so after that, you can see this one. This one is a form of ventilation, which is right now outdated, by the way. You can rarely find people doing this literally. Okay, in this position, it's called artificial breathing. Like you are helping them to artificially breathe, but it has several risks. You may be in even worsening the condition by introducing more bacteria into this people's system and all that. So this one you can do to your child. You can do to maybe a very close brother if you have no otherwise. And it's the same as no, yeah, it's not the same as that one. But that is basically number 3. We are also checking the pulse, that is the circulation, and making sure basically that these people are having like their hearts their hearts are pumping. And you know what is associated with heart not pumping? It basically means that you are now not supplying enough oxygen to the brain. And this one can easily lead to death. So I've talked of A, I've talked of B, I've talked of C, and I want to talk about C in a few more minutes. Wow. Okay. So yeah, so let's move a step higher. Now in C, that is the cardiovascular system, like the circulatory system. You check the pulse, and these people are not producing the pulse. Basically, mean they are not, the blood itself is not flowing, and so there's something called cardiopulmonary resuscitation, CPR, cardiopulmonary resuscitation. Basically, this aims in aiding the 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 flow of blood to the brain. And I want to show you a video. Uh, you just give me a minute and just get the video, then I'll show you. Okay. Yeah, so I'm talking about CPR, the cardiopulmonary resuscitation. And this is literally done to enhance, it's literally done to enhance the flow of
every
blood
day, delivering blood and oxygen to
into
every
the
cell in our
system.
body.
And
But when sudden
majorly we are
cardiac
targeting
arrest
the brain.
strikes,
So
our
these
heart
people
suddenly and
must be in a
unexpectedly
very
stops, any intervention
these
will
people
start to
must just be in a
minutes,
very
brain
flat
hands.
condition.
Performance becomes irreversible. The power to save a life is truly in your hands. Without any intervention, the brain,
Can
vital
you
organs,
get the
and our
sounds?
heart
Someone can
will
just
begin
confirm
to die.
that you can
Beginning
hear.
CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and
Can you
after
hear
10
the
minutes,
sound?
brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes two critical things. 1. Compressions move oxygen.
Wait, can you hear the sound? Oh, well. So I'm talking of a process called cardiopulmonary resuscitation. This is basically aiming to aid the blood flow into the brain, because without blood reaching the brain, meaning the brain will have a short supply of oxygen, and you can die anytime. So you realize a patient is having a brain a problem with the pulse. There's no enough supply of oxygen to the brain. So this is what is recommended. You put the patient basically flat, and this must be very flat, a very flat ground. So
Oxygenated blood to the
we
brain
can
to
take
keep the brain
2 minutes
alive. And
to get
2.
what is being
Compressions,
done.
blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood. Therefore, no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest.
Okay, well, yeah, so that is cardiopulmonary resuscitation, and I think you've seen. So there's a few things to note that maybe we didn't get clearly, but I'll send you the link so that you also can go through it once again. So yes, let me share. Yes, yeah, I believe you can now see my slides in a presentation mode. I want to kindly confirm very fast. Be in a presentation mode. Slideshow, I mean. Can you see my slide?
Yes, yes.
Oh, fine. Thank you. So, only someone who is trained to do this can do this. And in cardiopulmonary resuscitation, if you don't do it properly, it can harm the victim more. This one we always do. Like, let me say the what should I say? The standard. Like ile inakwanga the standard kabisa. On the lower side, it's about 30 compressions to 2 breaths. And this one, sometimes these people are really in a bad state that the heart itself is not pumping. And so you can even wonder, like, you can be like, I'll even harm to break a rib and allow oxygen to reach the brain so that these people don't die. So the intensity of doing this depends actually on how the patient is feeling. Then even as you do this, make sure ABCs are very important, like very, very important. And all that. So that is what I've explained here. You must not do it, consistently. You can give them some time to also have some rest, dogo. But this one will depend with with the progress. What progress are you making? So that is it. Today my laptop is having a lot of pop-up. Yeah. Okay. So I've talked about the airway obstruction. I've talked about how you can basically open the airway, and which position is supposed to put the victim into. Now, in a short, okay, no, let's talk about this condition. This, I think it's a Latin word, but this is a position which is helping you to consciously open the airways. Someone who may not be actually breathing well because there's an obstruction in the airway. So I really wish I could be doing this thing physically so that you see. But I won't show you the video for this. Basically what you're doing, you're making this, make sure these people are at the right angle with you. Make sure they hold just below their neck. And in this case, they kind of like block the airways as they release. So you're doing more of okay, you're standing behind the person, and these people may be choking and or just having an obstruction. So you place one arm around their waist, and the first position between the navel and the rib cage. Yeah, I think you can see what I'm speaking about. The second, someone is calling. Hello, let me call you in a few. I'm in a certain meeting. Let me call you in a few. So, thank you. So sorry for that. That is my brother calling. So make sure that you place your arm around her waist. And the other arm can be placed either just below the diaphragm. I think you can see, or you can place both hands below the diaphragm. Then you're like trying to apply an upward pressure, so that these people, you can initiate the the airways. Like you can initiate the the airways so that the obstruction can also not be there. At the same time, these people should actually strive to also remove this thing. I wish this thing can be physically done, but it's okay. You can see. So from here, just go and check how this process is done. I think I'm very sure it's in YouTube. So just go and check how it's done. And the main aim is that we are helping to unblock the airways. Yeah. I want to talk about bleeding because bleeding is something we talked about in in cardiovascular system. But I want to mention something on bleeding because you realize one of the philosophy was that you stop bleeding as fast as possible. So for you to stop bleeding, just apply a direct pressure to the point. Number two, you can also control bleeding by elevation. You see, the extreme end of your body, like the arms, if you put them against, like the heart is below now the affected point, and the real point facing up, then you can also be controlling bleeding, like hastening. That is called elevation method. You can apply pressure bandage, and you can also do cold constrictions, cold applications, so that you also promote vasoconstrictions. So these are the four methods on how we can basically stop bleeding. Direct pressure, you can elevate even as you apply the direct pressure. You can apply cold applications, like just a very wet material to the system. Yeah. This is more in cardiovascular system, but it also helps you to know where your pressure points are. In this picture there, the pressure points are elaborate enough. So even as you press, you have a bleeding, but what are you targeting? You are targeting the veins, you are targeting the capillaries, though not much, and you're also targeting mostly the arterial blood. So even as you apply pressure, know the pressure point where you are actually targeting. Yeah. So that is that. That is that. Okay. Okay. Now let's go to shock. Let's go to shock. Someone has fainted, and I want to get your views on this. Yeah, someone has fainted. It's 9:02. We have 10 minutes to be done with the presentation. Then another 10 minutes for questions. Then we'll be done. What do you do when someone has fainted? That is the layman's language. What do you do when someone has fainted? You realize now we are in the respiratory system now. What do you do? I think I can get two responses, then we'll just see. Yeah, guys, we've been talking about the basic principles of of first aid. We've talked about the ABCs. We've talked about ABC and D, ABCD. We've also talked about the philosophy of first aid. We've also talked about uh, what is your responsibility as a first aider, and what are you aiming? You're aiming at promoting promoting recovery. You're saving life, and you're also assisting these people, like literally. So, just now to get into the respiratory system, what do you do when someone has fainted? That is the layman's language. And see, and see, we were joined by one of our doctors today, Dr. Griffins. Griffins, you can say hi to us. Then just tell us something about when what happens. What do you do?
Hi.
Yes,
Can I?
we can hear you.
I'm not sure I was following enough to be able to say something. You said I say something about?
Yeah, it was more of a question. What do you do when someone has fainted?
Okay. When someone has fainted, maybe take a minute. One thing we first of all have to confirm is common things that I know, like we had been told. We have to approach them like a person who is unresponsive. You find someone lying down, they are unresponsive. So when you find someone who is unresponsive, like we had been told, we are concerned about the first common causes of death, which is lack of air, one. Number two, poor blood supply. So as we get to that place, first of all, you ensure that you, the person who is coming to help, you are protected. So you have enough protection. If you need to put on some gloves, if you need to hold the people using some clothes, because you're not sure why they have fainted, it could be poisoning, it could be anything. Then from there, once you are protected, you put them, you consider airway. If you don't insert your hands into their mouth, but you look in through the mouth and through the nose. If there is any obstruction, then you intervene at that point by trying to remove the obstruction of the airway. Like we had been taught, I think he had captured the airway. And also in terms of positioning the airway so that you can open the airway. I hope you remember the positions that he presented. Then number two, if in any case at that point that persons appear to be vomiting or foaming in the mouth, the first thing before you put anything would be to put them in the recovery position. That I think was also mentioned correctly. Then after that, now you come to the hands, you try and get if you can get their pulse. If you can't get their pulse, you get into the chest and start doing the chest compressions as you have been told. We do 30 chest compressions as we wait or as we okay, I assume in the moment you saw someone is unresponsive, you called the emergency numbers or you have called an ambulance and this person is rushing to the hospital. And the moment you are on with chest compressions, you don't stop chest compressions until someone who is a doctor has arrived or the ambulance has arrived, or you can now feel the pulse. When you touch the pulse, I believe the facilitator will tell us when to check the pulse. Yes, and I think from circulation, from there now, we can go to others. Now, in terms of if there was something like, okay, if you're not sure of what has caused it, if you are able to take their sugar levels, able, then you can, okay, I think from there is more of intervention with drugs, but ensure that if the person has any constricting clothes or any exposure to any chemical that you are not sure of, you expose their whole body as the fifth one. Once you have done that and someone is still okay, if you have done all those things and you see the first part is okay, then the second part, which is secondary survey, just try and check if the person has any harms or any wounds around them so that you can cover them as they get to the hospital. I don't know. I've really tried to summarize how to approach the person who is lying down and responsive. I believe that is what you meant by saying shock.
Yeah, sure. Wow, thank you so much, Griffiths. That was elaborate enough. If you are very keen about what he has said, he has basically mentioned the A, B, C, and D. And D, but they also meant that yourself, your protection is very important. That even as you handle such patients, you are also protected. Imagine in a case of maybe bleeding, then you know very well you should be applying pressure. You take a cloth, you apply the pressure, but now blood has overflown the cloth. And so you are even putting yourself into more risk. You may be trying to help the situation, but what is your safety? Where does your danger lies? So that is very important. He has talked about the ABCs, the circulation, the breathing, the airways, and lastly, danger. And remember, maybe as a medical missionary, you are not the ultimate. Okay, well, the whole point is you may be trying, yes, but if are you seeking for medical attention? That is the whole point. That even as you do this, you are not a doctor. There, you may be retaining these patients here, but they're actually going to die in your hands. So, what efforts are you making to uh, the nearest medical facility? So that is very important. If yes, you may have promoted all this, but make sure the final destination be the hospital. In a case of advanced conditions, sometimes someone may be just having, let me say, a venous bleeding, and yes, you stop the bleeding, but you've not even disinfected the site, and so you advise these people to go. They don't even know. Okay, well, you may have explained, but make sure at least if you have the disinfectant and all that, make sure they're done. If you don't have them, refer them to the hospital so that the wounds may be dealt with effectively. So I think that is all about today. I can see it's 9:11, but I want to get some few questions if we may be having any, and we'll be able to share the notes with you about the basic, so that if we will now be talking about some of the conditions of the respiratory system and how to manage them. You must have the background information on how to do all this. Yeah, so do we have any question? Today I don't want us to extend. Uh-huh. Yes. Do we have any question? Well, there's an act. I think it's called the Good Samaritan Act or something. That any person having an intention of helping a victim in case of an accident or something, and you identify yourself, there are cases which such instances maybe can end in courts. So, with an intention of helping someone, and the condition just gets worse, and you are identified in that case. So, in that case, you're not accused of the same. So that is one of the acts which are covering the first aiders. So even as you want to start the first aiding process, please identify yourself. In a case of an accident, you may try helping, but these people mistakes you to a thief. Wasema ulikuwa unataka kuwaibia. So what happens? You even put your life into danger. So identification is very important, and even as you identify yourself, make sure you involved. Like you don't just do it alone. Yeah. Okay. Well, so if there are no questions, I beg to stop.
I have one.
Okay.
Yes,
Yes.
I'm asking about this this disease of kifafa. Ni ile yenye inaangusha watu chini, si ndio?
Yeah, you can speak in English. Yeah.
Is it happen that I don't know it in English, so I can't explain myself very well. But I think you can get me so that you elaborate to others who doesn't get Kiswahili. So hiyo ya kuanguka watu where people fall down and their mouth start forming and they just tremble tremendously. That kind of disease. So where do we place it? Is it also something about the fainting or whatever? Do we handle it the same as the process we've mentioned?
Okay. Thank you so much. Kifafa is called epilepsy, I guess, in English. Kifafa. Yeah. So the question is, do we handle it the same way? My response, of course, if you have any response as well, you can give. But I started by saying the ABCDs are the basic primary functions of life, of your life support system. And so this is more of a compromise situation. And so even as you handle it, make sure the A, B, C, D are like are observed. But this is a very distinct, like specific condition. You know the problem. So just make sure these people are having their airways open. If it's in a recovery position, which sometimes may be very hard to put these patients in, make sure like at least the circulatory system is good, the pulse rate, like the pulse, you check the pulse, they are good, the airways are good, these people are breathing. That is where we start from. Yeah. So do you have any addition to his question? Maybe someone can say something about any special way, because that is the starting point for any first aid. Okay, well, so yeah, I think you are answered by the.
Excuse me.
Yeah.
Is epilepsy treatable using natural remedies?
Wow. Is epilepsy treatable? Using the natural remedies. I don't know. Maybe Griffins can tell us something about the treatment. Because I only know of specific like conditions where this one can apply. But let's start from this point. Is epilepsy treatable? Griffins can help us understand that, if you don't mind.
Okay. Good evening. I hope you can hear me.
Yes, we can hear you.
Yes.
Though low.
Okay, so I'll try and raise my voice. Okay. So first of all, an epilepsy is a problem where your brain is not firing well. So when your brain is not firing well, that's what causes the convulsions. Usually, from a medical standpoint, we are unable to treat it. We can only control the convulsions. So it is not a condition that we say we will treat from the hospital, but we will always regulate it so that if we have at least not more than 3 seizures in a year, then we say we have well-controlled epilepsy. But now, from a natural standpoint, I do not have enough. I don't have enough information to talk about it. Yes, so I also do not have any data whether it can be treated or not from a natural standpoint. Probably when we give it the eye that God is a super healer and we pray, and that would be now faith-based and miracle-based. But basically just a scientific evidence of treating naturally, I don't have, and I am unable to say that. But medically, it is not treatable. Yes.
Wow, thank you so much. In hospital, I always see they give anti-epileptic drugs, and sometimes they even refer you to, to do a brain surgery, something like that. But I've never heard of a case where epilepsy has been treated. So yeah, so that is it. Yeah, I think you are answered by the. Okay. Well, so any last question? Can see our time is up now. Well, so tomorrow is Friday. Next week we'll be able to tackle some of the respiratory conditions and their natural remedies. So we'll be able to see about the pneumonia. Of course, we had talked about, Dr. Gideon took us through pneumonia, but we'll be able to revise a bit of it. We'll be able to see how can we manage tuberculosis naturally. We have the stroke, we have lung congestions, we have conditions like bronchitis, asthma patients, and just several of them. So they will be divided into two. We have the lower and the upper respiratory tract. So be sure to be there, and also do your research on the same, so that even as we meet, we don't start from a 0 point. Yeah. So I'd love to pray. Then I'll welcome Denzel.
I had
Oh,
that
there's a question.
question.
Oh, it's okay. I'm just
Yes,
seeing
I
it
had
right
not
now.
it through the message.
Let me read it aloud. What can cause a person not to breathe while sleeping? When trying to breathe both through the mouth and the nose, it becomes impossible. What might be the problem? Okay. So, what can cause a person not to breathe while sleeping? When trying to breathe both through the mouth or the nose, it becomes impossible. What might be the problem? Okay, well, sawa. The question is in the chat box. If you remember keenly, there is a position I showed you where I was talking about the 90-degree position of it was a condition. It was a position for breathing. Sometimes when we sleep, we put like our how do we call it? Like we put our head in a condition that obstructs the airways. This can be one of the problems. You can just be having just an obstruction, literal obstruction of the airways. You can also be having conditions like, for example, pneumonia. You can also be having other conditions which are making actually your windpipe to be blocked, maybe by too much production of the mucus in the system. And so these are some of the conditions which can basically make you to not to breathe properly. So in such cases, you just have to assess like what can be the problem. Of course, referring back to the history and other conditions. So did I get the second part of the question? When trying to breathe. Oh yeah, sure. We'll also talk about sleep apnea. Yeah. Thank you for reminding me that. Yeah. So I wish to stop from there. Be sure to join the subsequent sessions so that we also know about all this. Asthmatic people we have a session for asthma. So don't worry, Selvin, about the question. Yeah. So let's pray and end it there. Our Father and our God in heaven, we thank you so much for helping us understand what you had for us today. Thank you for leading us all this way. Father, we pray that all that we've learned that are not in order, that you may help us to forget about them. But that which is in order, just for the sake of your kingdom and for the sake of this ministry you call us to do, Father, may we embrace every bit of these aspects. That even as we look forward to doing your work in this field, Father, you may enlighten and enrich us. And when all is said and done, may all this point us to the cross. For this I pray in Jesus' name. Amen. So welcome back, Denzel.
Oh,
Okay.
I just am on this other end. I'm really delighted he has left. Dr. Griffin's joined us today, and it was a blessing. So we've said a closing prayer, and due to time, we'll just close. The condition that the question that was asked last, the one that Elisha was laboring to answer, is called medically. It's called sleep apnea, and we'll talk about it. It's this that we'll mention as we start talking about the diseases of the respiratory system. So I think that's all for today, and we have a blessed night.